In an opioid overdose, if someone's not breathing, the minutes and seconds matter. So even if the naloxone arrives only a couple of minutes before the ambulance, that's actually a really significant amount of time when it comes to the amount of brain tissue that could be saved there.
Dr. Caroline Copeland is a researcher at King's College London and the director of the National Programme on Substance Abuse Deaths, an initiative which collects data on the nature, time, date and location of drug-related deaths from coroners across England, Wales and Northern Ireland. It was this data set that first sparked her collaboration with fellow King's researcher and drone enthusiast, Dr. Paul Royall.
Caroline's data set highlighted a group of about 58 patients or people that had suffered an overdose that sadly had been proven fatal. But we had a location and a time and a date, so therefore we could model the speed of arrival of a drone and an ambulance.
Using this real-world data and focusing on opioid overdoses where a bystander was present, Paul and Caroline were able to retrospectively model the time taken for an ambulance to arrive to the scene versus a drone carrying naloxone, a life-saving drug which reverses the effects of opioids and rapidly restores normal breathing. So what was the result?
78% of cases, the drone got there in 7 minutes, but in only 14% did the ambulance get there. And those numbers sound horrible for the ambulance, because it's like, cripes, does an ambulance ever get there? But we have to remember that this data set is made up of fatal opioid overdoses and just demonstrates that if an ambulance was called in these cases, a lot of the time it was not able to arrive in time to help and reverse the opioid overdose.
It seems that drones can reach patients within NHS target times more often than ambulances, and these were commercial off-the-shelf models. With slight tweaks to the drones, Paul and Caroline found that they could arrive within 7 minutes in 98% of the overdose cases.
We were using, weather variables and considering which one of those could stop a drone flight. And it wasn't actually the wind and the rain that was the problem, it was the temperature that was the biggest problem. And if we had either, I think in the paper we say something like temperature-controlled cargo cradles to stop the naloxone from actually freezing, because as it flies through the air, if it's just strapped open to the elements, the formulation would have got too cold. But I think that just some bubble wrap would probably do, which sounds nowhere near as impressive as temperature-controlled cargo cradle.
Adding bubble wrap to prevent medicines from freezing in the sky is a solution to one problem, but there are still many other hurdles that need to be overcome before rapid response drones can be readily deployed in the UK. Edward Anastassacos is the CEO of Herotech8, a company that's developing a nationwide network of drone systems using its automated drone-in-a-box technology.
I think the platform technologies are largely there, but they are not necessarily there in terms of we've gathered enough evidence as an industry. We've not engaged sufficiently with the public. Debatable, I think. But understanding what people on the ground, for example, accept as safe is very different also from what the regulator might accept as safe. And also from an operator standpoint. Those are all conflicting inputs that you need to consider in order to push something like this forward commercially. And this is what we're trying to gather, I think. This is what we're trying to understand through this project.
Along with surmounting regulatory challenges, there's also the question of how drones could actually be incorporated into the emergency response. The idea is not to send the drone instead of the ambulance, but rather to use the drone to deliver naloxone ahead of the ambulance, so that a bystander could administer the medicine by nasal spray before the paramedics arrive. Paul hopes that much like the Helicopter Emergency Medical Services, HEMS, drones could be employed through connecting the emergency call handler with a drone operator, who would then remotely oversee the flight of the drone.
Ambulance service, is the patient breathing?
The emergency services, the 999 call handler, will get in contact with the drone operator. The drone operator will fly the drone remotely to the location that's given to them by the call handler. The area itself would have been pre-surveyed, so flight risks, areas where you can fly over and where you can't, would be assessed, but then it would just be a straight line from the launch pad to the area where the suspected overdose is occurring. There's onboard collision avoidance, and there's cameras for the remote drone pilot to make sure that the drone is landing safely.
Working out how to modify the emergency services script and instruct bystanders on how to safely remove and administer naloxone is part of the ongoing research Paul and Caroline are conducting to expand their feasibility study. So, could we expect our skies in the future to be full of drones as part of our health service?
I think so. I mean, we're seeing this in different countries already. In Africa, you see, Zipline, they're doing fantastic work, thousands and thousands of flights to deliver blood, for example. So I think that we should expect this. It's the timescales, I think, that we're all in a somewhat hazy position to gauge. And I should also add that you may see something that's quite interesting from a user or an adoption position. Industry is already familiar with drones, but what you will see is probably not a lot, and then suddenly a big spike once these barriers have been overcome or people learn how to overcome them.
I've been to a couple of conferences and talks at coroners' offices where I start talking about naloxone by drone, and they all look at me as if I'm mad and that this is some form of future that isn't yet here. But if you walk around, I think it's Milton Keynes or Letchworth Garden City, you've got robots doing all sorts of deliveries around there already. So this will just be adding to that.